And many thanks for joining us on Nationwide today. I am Habiba Oladipo. Let's begin with Mitare Ikpen, who is live at the SGS office in Abuja for the Ministerial Presidential Task Force briefing. Mitare, can you give us a highlight of what's going to happen today?
Yeah, Habiba, today's start. At the moment, if behind me, you'll see that seats of the presidential empty. Does not mean that usually before they come to brief on a daily basis. It's possible right now they are meeting, but then we the hall have other stake on the hall who are they're waiting to get clarification, ask questions on.
We sincerely apologize for the poor audio and visual quality in that report. Moving on, 35 new cases of COVID-19 have been reported. Records from the NCDC indicates that 19 of the new cases are in Lagos, 9 in the FCT, 5 in Kano, and 2 in Oyo State. As at 10:20 p.m. 16th April, there were 442 confirmed cases of COVID-19 reported in Nigeria. 152 have so far been discharged, with 13 deaths. As one who believes in public service and a servant to the people, President Muhammadu Buhari, in his first election in 2015, said he belongs to everyone and belongs to nobody, and expects same commitment from his aide and other members of his administration. A statement by the Senior Special Assistant to the President on Media and Publicity, Garba Shehu, says, President Buhari believes in loyalty and truthfulness and has shown commitment in that regard, as a number of ranking officials have been shown the way out at various times simply on account of questionable integrity, usually done on the basis of evidence and proof. The presidency expresses disappointment over a politician accusing unnamed individuals in the administration of unnamed transgression, asking the politician to come up with evidence and proof if he has any. The statement also implores Nigeria to join hands with government at this critical time to battle against the coronavirus pandemic. Muslim faithful this Friday observed the Jummah prayers in their domain in compliance with the stay-at-home order. Mohammed Rabiu Ali visited some places of worship in Kano metropolis and brought back this report.
That was last Friday Jummah prayer in Kano before the outbreak of COVID-19. But the story is not the same today. This is Central Mosque Kano, where hundreds of Muslim faithful converge, but the lockdown order has forced many to pray at home. Most of the places of worship visited by NTA News observed that they are under lock and key.
With 7 days to the month of Ramadan, where these mosques will be fully utilized by worshippers, what will be the next action if the pandemic continues? Only time will tell. Muhammad Rabiu Ali, NTA News.
And Nasarawa State government extends the 2-day lockdown in Karo local government area for additional 10 days as part of measures to contain the coronavirus pandemic. Governor Abdullahi Sule, who announced this in Lafia, says curfew for the time in Lafia and other parts of the state is still in force. Aliyu Tijani Mohammed reports.
Nasarawa State is yet to record any case of coronavirus. It is against this background that government says Karo, which is the gateway to the nation's capital, should remain under lockdown for additional 10 days as workers are expected to work from home. To enable residents of the area buy essential items, there will be a relax on the restriction of movement every Wednesday and Saturday between 10 in the morning to 2 in the afternoon. Governor Abdullahi Sule, while appreciating the people of the state for complying with the order, says all public gatherings remain suspended.
It has become imperative for the government to consider the necessity to extend the duration of the lockdown by additional 10 days. This is in our collective commitment to continue to contain and control the spread of this pandemic in our dear state.
On palliatives, the governor says food items have been distributed across the state as he assures the people that more will be rolled out. So far, the state government received more than 70 million naira donation to fight COVID-19. In Lafia, Aliu Tijan Mohammed, NTA News.
And the People's Republic of China, in contribution towards the implementation of a coordinated response to COVID-19 pandemic in Nigeria, has donated another set of medical supplies. A statement by the Chinese embassy says the new donation was handed over at the cargo wing of the Nnamdi Azikiwe International Airport, Abuja. The items were handed over by Li Yuan, the Chinese chancellor, on behalf of the Chinese government, and received by Abraham Yakubu, the deputy director for international cooperation, Ministry of Finance, Budget and National Planning, on behalf of the federal government of Nigeria. The items include 1,500 pieces of respiratory masks, 10,000 pieces of surgical masks, 1,750 pieces of disposable surgical gown, 350 pieces of infrared thermometers, 1,750 pairs of medical goggles. Others include 9,750 pairs of gloves and 9,750 pairs of shoe cover. The items are the second batch of medical supplies from the government of China. And the Rivers State government has highlighted strategies put in place to ensure that the state is free completely from COVID-19. Governor Nyesom Wike, at a press conference in Port Harcourt, said, though some of the measures are painful, they are in the best interest of the people.
A briefing by the Rivers State Governor Nyesom Wike centered on the progress made in the fight against the spread of COVID-19 and the new policy direction the state is pursuing. The governor said that all the precautionary measures adopted by the state, ranging from the closure of boundaries to social distancing, have helped to contain the virus.
A lady who was positive, and that lady was taken to the treatment center. And after the treatment, she became negative, and that lady was discharged. I want to inform you positively today too, and the Commissioner of the Health is here to confirm that the second case, which was positive and was taken to the center, from the information I have, has tested negative and will be discharged this morning.
Governor Wike said the state is also distributing palliatives to cushion the hardship caused by the measures adopted. He said so far, 5 local government areas have received, while distribution is still ongoing. In Port Harcourt, Ogedi Nyekwere, NTA News.
And recent predictions by the World Health Organization says Africa might be the next epicenter of the COVID-19. So joining me in the studio is Dr. Usman Galadima, a fellow of the International Society of Nephrology and a physician with the University of Abuja Teaching Hospital, Gwagwalada. It's good to have you join us in the studios, Doctor.
Good evening.
Okay, Doctor, what's the prediction? How are you taking it that Africa might be the next epicenter of COVID-19?
Okay, yeah, this actually started with a Lancet publication in February of this year, where it's a modeling study, where some kind of study were done, and that study predicted the vulnerability risk of African countries, and this was based on the ability or functional capacity of each country to mitigate or tackle issues of health security. And this was also based on the WHO International Health Regulation Monitoring and Evaluation Framework. Now, based on this, about 13 countries were considered to be moderate to high risk of vulnerability to COVID-19 disease. So, and Nigeria was part of it. Okay. Now, again, many other foreign workers or diplomats, so to say, also expressed concern because Nigeria in particular is the most populous country in Africa, and generally people are not adhering to government regulations concerning stay at home and physical distancing. And again, even the lockdown is not nationwide.
Okay.
And you can see that there are multiple clusters of infection erupting in different parts of the country. So based on all this, there is fear that when we get to the community phase, which we are now, where people were seeing large cases or large numbers of people infected with coronavirus infection, that are not linked to the initial chain of transmission.
Okay.
So that means community transmission has started. And when this happens, it's going to be monumental. We've seen how it's been in countries like Italy, Spain, and France. And so this infection took that trajectory in those countries.
Okay.
And so based on what is on ground and that potential of the virus to cause this kind of problem, it is easy to predict that if we do not strictly enforce the detection, prevention, and control modalities and ensure physical distancing and nationwide lockdown, we are going to follow suit.
Okay, so doctor, can we say testing is also an issue, because we know it's also a global issue? Can we say testing too has attributed to the concerns?
Yes, because as you rightly noted, it's a global issue. If you need to test to know who has the virus and moving around in the community. So if this is not adequate, you will not really see what is happening below the surface. And but now you can see with the daily increase in number of people that are infected, and this is because of our increased capacity to test more people. That's why probably we're seeing this. So testing, indeed, rapid diagnosis, detection is very important.
Okay, so with this prediction, which is very scary, that Africa will be the next epicenter, I'm sure a lot of people are apprehensive about that report. I know you mentioned restriction of movement of people to curb this, but what other ways can the citizens themselves help in this regard?
Now, the citizens must adhere to the regulations that have been given out by government. We, first of all, must stay at home. We must observe the various safety measures, avoiding crowded areas, washing our hands with soap and water at least for 20 seconds. Okay, as Sanjay Gupta will say, you sing your birthday twice. Sing the happy birthday song twice. That will approximate to about 20 seconds. And then, observing the respiratory or cough etiquettes. You cough into your elbow or into tissue and dispose, and so on. And wearing a face mask if you are infected, and for those, if there is any need for you to be in the crowd in the first place, you should also wear face mask because of people with asymptomatic or pre-symptomatic infection. So these modalities, if we are able to adhere to them, because this is what has been shown to work in every other place, okay, in curbing the spread of the disease.
Okay, and I want to ask you, where are we? Okay, doctor, we'll take a break now. We'll be back shortly with more on this interview. Stay with us. We'll be back shortly.
This is not a joke. It is a matter of life and death. Mosques in Mecca and Medina have been closed. The Pope celebrated Mass on an empty St. Peter's Square. The famous Notre Dame Cathedral in Paris held Easter Mass with less than 10 people. India, Italy, and France are in complete lockdown. Other countries are in the process of following suit. We cannot be lax.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Dear brothers and sisters, in view of the COVID-19 pandemic we are currently challenged with, we at Al-Habibiyya Islamic Society enjoin all Muslims to adhere strictly to government directives geared towards stopping the spread of the virus. These measures include the stay-at-home order, washing of hands with soap and water, using hand sanitizers where water is not available, and other hygiene measures. We remind you all of the words of Allah in the Holy Quran, chapter 2, verse 195, which says, "And do not throw yourselves with your own hands into destruction." We also remind you of the hadith of the noble Prophet Muhammad, peace be upon him, which says, "Do not cause harm or return harm." Please stay at home and stay safe with continuous dua. This message is from Project Itfine of Al-Habibiyya Islamic Society. Al-Habibiyya Islamic Society, from Allah to you, a light.
Alpha, say tomorrow still day on.
What's tomorrow?
Community meeting now.
You know they here, Abi?
Now beg you. See, if we meet for my house, inside parlor, then go no.
This COVID-19 is not a child's play.
If you want to elect a new secretary, we fit
do one for WhatsApp or for Skype or even on Zoom. Or we just wait.
I will not negotiate
this social distancing. It is not negotiable.
Not every infected person shows symptoms, but every infected person is contagious. Avoid large gatherings and self-isolate if you think you might have come in contact with a carrier. Your safety and the safety of others is in your hands.
This message is from the Akin Fadei Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
I just don't understand this coronavirus thing. Is it real?
See, coronavirus, known as COVID-19, it's a global problem and has killed thousands of people in China, Italy, Spain, UK, US, and other countries around the world.
Okay. Now, why are they saying that we should stay home?
Because if you go outside and get in contact with someone who is infected, you become infected and then come back home, affect your family. That's how it happens in other countries.
Now, please help me explain what this social distance is all about.
See, as we are now, the virus travels through the air and by touch. We must maintain 6 foot distance at all times.
Oh, so it's not by washing my hands with soap and water or hand sanitizer that is only important?
Washing of our hands regularly is very important. But we must come together and fight this virus like we did Ebola. It is our responsibility to each other.
Many thanks for being there. The United Nations has received delivery of vital health supplies to support the fight against COVID-19 pandemic in Nigeria on a flight funded by APM Terminals.
The supply is made up of 10,000 test kits, 15 oxygen concentrators, and various personal protective equipment, vaccines, kits, and other vital health supplies will support the Nigerian government's COVID-19 response plan and UNICEF's work with children and families in Nigeria. The supply will also support the government of Nigeria through the National Center for Disease Control to prevent the response to COVID-19 pandemic in affected states across the country. The supplies are co-financed by the European Union and IHS Nigeria, the Nigerian subsidiary of IHS Towers. Additional COVID-19 response supplies are expected in a UN joint flight to be delivered to Nigeria in the coming days. The United Nations resident coordinator in Nigeria, Edward Cullen, says to limit the spread of the coronavirus, it is important to test as many people as possible, especially those with recent travel history and those who came into contact with travelers. These test kits will support Nigeria's drive to control the transmission of COVID-19 infections and support the government's ongoing strong efforts to protect the country from an escalating pandemic. Since the outbreak of the coronavirus in Nigeria in late February, the UN has been supporting the government of Nigeria to respond to the pandemic through risk communications and community engagement, infection prevention and control, epidemiology, surveillance and management of coronavirus cases, working with government and other partners. In Abuja, doing Dia NT News.
And Dr. Usman Galadima is still in the studio. Doctor, before we went on the break, I was going to ask you a question, but from that report, we've seen the UN sending in medical supplies, we've seen China sending in medical supplies. How is that to you?
Well, to fight this pandemic requires a concerted global effort.
Okay.
Everybody must put their hands on deck, because if you sort it out in one part of the globe and the other part is still raging, nothing has been done really. So it's a welcome development that the world, every other place, every other part of the world is giving a helping hand to the other part. We saw also recently the EU Parliament apologizing to Italy for not coming to their aid on time.
Okay.
So I think it's to avert those experiences that we're seeing a lot of donations and contributions from various organizations. Okay. So it's a welcome development, yes.
Okay. Is it enough? Can it ever be enough?
Well, it cannot be enough. Okay. It cannot be enough really, because we've not attained the apex of this disease yet, and we don't know what the apex is. Okay. And this is a country of 200 million people. So it can never be enough really.
Okay.
Yeah, we'll keep receiving them.
Okay, so in terms of UN and World Health Organization on Nigeria's effort at curtailing the spread of COVID-19, where do you think we stand?
Well, both WHO and UN have applauded Nigeria for their efforts so far. We have the Ebola experience, and we also have an elaborate polio infrastructure or network. So I feel Nigeria has the capacity to be able to handle this pandemic as well.
Okay.
Yeah.
Okay. And are you impressed so far with the testing? Yesterday we saw them testing some people in Pape, other parts of the FCT. Gradually they've been testing people.
Yes, that is very impressive. South Korea did something like that, started with something like that, elaborate testing, and that has been able to curtail, the scourge of the disease in South Korea. So if we're beginning to test, is the way to go. And I'm happy that this has started and we have seen in some parts of FCT.
Many thanks, Dr. Usman Galadima, for sharing your thoughts with us on Nationwide today.
You're welcome.
And today there was a fire outbreak at the INEC headquarters in Abuja. Mayor Gidi has that report.
Lockdown unlocked at the INEC headquarters, Abuja. No thanks to fire outbreak. The main story building standing tall, overlooking the adjoining smaller ones. These flats, separated from the main building, houses the media center and the elections and political parties monitoring department. And at about 11 a.m. Friday, smoke was sighted at the elections and political parties monitoring departments.
A few staff in the office of the director, election and party monitoring, and they noticed smoke coming out in the office. So they rushed out and then made sure that and went to the fire service within the commission itself, who came to begin to make attempts to put out the fire.
No life was lost, but
In terms of actual damage, some of the things we lost are photocopiers, computers, and other office equipment. But there's no serious and fundamental damage done to any of our critical documents and materials.
This brings to 3 major fire incidents in the Federal Capital Territory in less than 2 weeks. First was the Treasury House, the Corporate Affairs Commission, and now the INEC headquarters, all attributed to electrical faults, and there is a call for more prudence. Mie Ogidi, NTA News.
President Muhammadu Buhari Thursday evening described as extremely horrifying the death of 13 persons and injury to many from a fire incident at an IDP camp in Borno State. Naja'atu Tijani reports.
Reacting to the sad incident, President Muhammadu Buhari directed the Ministry of Humanitarian Affairs, Disaster Management and Social Development to investigate and report the circumstances leading to the fire, as well as advise on ways to avert a future occurrence. He further directed that urgent assistance be given to victims as he prayed for the repose of the souls of those who died in the incident and the quick recovery of the injured. Meanwhile, the Minister of Humanitarian Affairs, Disaster Management and Social Development, Saidia Umar Farouk, commiserates with the families who lost their loved ones in the Thursday inferno at the camp for internally displaced persons in Ngala local government area of Borno State.
And staying with fire incidents, an 8-year-old child and property worth over 70 million naira have been lost to a fire disaster at Muda Lawal Market in Bauchi. Bulka Fausa reports that more than 16 shops were also affected by the inferno.
Muda Lawal Market is the biggest market in Bauchi metropolis. The fire was believed to have started when a vehicle loaded with mattresses caught fire and later on spread to nearby shops. Chairman of the Muda Lawal Market Association, Bala Maikaji, described the incidents as unfortunate and called on governments to come to their aid.
Abin da yake tare mana hankali shine na rashin ran, domin rashin ran duk ya fi wannan maganar dukiya. Dukiya kuma da aka rasa akalla zan ci wannan dukiya da ta kai sama da naira miliyan 70 saboda akwai motoci.
In Bauchi, Bulak Afsa, NTA News.
And Ruth is standing by in Lagos with more reports from that zone.
Habiba. Among the COVID-19 deaths in Nigeria is a medical doctor, Emeka Chigbo. Confirmed reports say Dr. Chigbo, a gynecologist, got infected with the virus after carrying out a cesarean section on a pregnant patient without prior knowledge that she had the virus. Victoria Olabode, who spoke with authorities at the Lagos University Teaching Hospital, LUTH, on the demise of the doctor, now reports.
Late doctor was suspected to have contracted the virus from a COVID-19 positive patient who was said to have arrived from Dubai. The medical doctor, who died at the isolation ward, was rushed to LUTH on the 12th of April and died on the 15th. The chairman medical advisory committee of LUTH, Professor Wasiu Adeyemo, while speaking on the incident, urged medical practitioners to always take precautionary measures while treating patients.
So it is advisable that anybody with a suspected case of COVID-19, as well as those with confirmed cases, should find their way to the COVID-19 centers.
Professor Adeyemo enjoined Nigerians to cooperate with government in the fight against COVID-19, which is ravaging the world. It disclosed that the Lagos University Teaching Hospital now has facility to test and get a result within 24 hours. In Lagos, Victoria Olabode, NTA News.
Now, while the coronavirus pandemic continues to ravage global economy, the latest quarterly report from the International Maritime Bureau indicates a sharp rise in piracy and criminality in the Gulf of Guinea. Key players in the industry say this is a clarion call that the coronavirus could be the basis for the proliferation of crime, and to frontally address the problem, the Nigerian Maritime Domain is activating aggressive surveillance along the country's exclusive economic zone. Michael Olale reports.
The report, which covers the first 3 months of 2020, shows that 47 attacks were recorded on the sea globally, in contrast to the 38 attacks within the same period in 2019. The Gulf of Guinea, which remains world's piracy hotspot, recorded 21 attacks, in which 17 crew were kidnapped in 3 incidents. While the International Bureau is advocating onboard security measures, the maritime industry in Nigeria is strengthening cooperation and information sharing. This meeting with the Navy is aimed at addressing issues ranging from detention and arrest of vessels, enhancing joint security in the secure anchorage area, and integrate operational surveillance.
I tried to study the possibility of the integration of Vulcan I and the C4I, so that we can have real-time, one-time information in terms of intelligence gathering and what we have to do to ensure we have a proper and adequate control of our own waterways.
The Navy is also open to the idea of integrating the hydrographic department of both agencies in the interest of maritime safety.
We have to end the news here to join the Presidential Task Force daily briefing on COVID-19.
This is the network service of the NTA. We now join our outside broadcast crew for a live telecast